Hello everyone and welcome to childbirth. That's right, today I am putting you guys through the torture of witnessing childbirth. I'm not really sure how much it shows, but if it shows anything too inappropriate, there will be blurs placed on the video. Don't worry, you don't have to look at any... I'm not even going to explain it. Let's start.
Welcome to Parent Point. I'm Dr. Rachel, OBGYN, and I'll be walking you through an interactive natural childbirth today.
Yay.
As a doctor, the birth of a baby is the most remarkable thing that I get to experience. While much of the process during childbirth is the same from woman to woman, each birth is still unique in its own way. Did you know that more than 2/3 of all babies born in the United States are delivered vaginally?
I didn't. Thank you for telling me.
Average costs for a vaginal delivery without complications in the U.S. range from $6,000 to $10,000. Whether a woman chooses to deliver vaginally or through cesarean section, commonly referred to as a C-section, I always recommend that my patients do their research and make an informed decision based on their personal medical history and circumstances.
Look at that blood, guys. Look at that blood.
Natural childbirth is the process of giving birth to a child without medical intervention. No drugs are given to relieve pain or aid in the birthing process. Most doctors find this approach to be the safest for the baby. A standard delivery is separated into 3 stages of labor, typically lasting from 5 to 24 hours, depending on the conditions. The first stage is the beginning of labor, which is characterized by the onset of contractions and the dilation and effacement of the cervix. The next stage is the actual delivery of the baby. The final stage is the delivery of the placenta.
That is so disgusting
which is an organ that connects
looking.
the developing fetus to the uterine wall to allow nutrient uptake, waste elimination, and gas exchange via the mother's blood supply. Now that we've covered the basics, let's deliver a baby.
Okay, sure, why not?
Our patient today is in her late 20s and is in pretty good health. She came into the hospital after her contractions became stronger and closer together. She is in her 39th week of pregnancy, so this baby is ready to enter the world.
Let's do it, baby.
A fetal monitor will be used to make sure mother and baby are doing well during labor and delivery. 2 electrodes are placed on the mother's abdomen to monitor the baby's heartbeat, as well as the strength of her contractions.
I feel like we're starting to get into non-YouTube territory here, guys, but this is a very educational video, okay? Okay, what we need to do here is we need to place the fetal monitor on this lady, okay? And then we need to place another fetal monitor on this lady.
A blood pressure cuff will be applied to check the mother's blood pressure throughout the procedure.
Natural childbirth, my ass. What the hell is all this technology, man? I thought we were going to deliver like an Amish baby or something. Come on.
Our patient and baby are doing fantastic. Let's feel the patient's stomach to check on the baby's position.
Boop. Oh, there's an ass up there, baby ass, and baby head down there.
We can feel that the baby is positioned to come out head first, so we do not have to worry about a breech birth. That is, where the baby is positioned feet first.
That would not be good.
Whoa! Our patient's water just broke. Now
Yay!
the amniotic sac is broken. We need to get our patient to assume the birthing position. Our patient is now having some painful contractions, so she is doing the breathing exercises she learned in her prenatal classes. Remember, since she has chosen to have a totally natural birth, we won't be administering any pain medication.
Now what, woman? Now what?
Okay, now we want her to bear down and push.
Oh, God! 40 minutes and lots of pushing later. Just a vagina on my screen.
I can see the baby's head crowning.
What?
Occasionally, forceps or a vacuum is needed to help ease the baby through the birth canal. But we are doing okay right now. We are, however, going to help our patient slightly using our hand. This will provide added space for the baby to come out.
Jesus, can we just stop for a second? I need a second, guys. Okay, this giant vagina in my face right now. And they're like, oh, you know, if the baby can't come out, we can just reach in and grab him, or we can use a vacuum to suck him out. Those are some good faces. Can you stop, please? Oh, yeah, just make a better face now. That's the best thing to do here. Each side of the vagina, we're just going to click on each side of the vagina here and just kind of pull it open to get the baby out of here. Well, we got a finger in there. Oh boy. There's some blood on my finger too, guys. I gotta kind of explain what's happening here because I cannot show this on the internet. YouTube will be very mad at me for this, I believe. No, other side. Just gonna give that another poke. Okay. Yep, just a good looking baby head there. It's popping out.
The baby's head rotates as it exits the mother's body.
Okay.
Before we fully remove the baby from the birth canal, we need to make sure the umbilical cord isn't wrapped around the baby's neck. Fortunately, in this case, it isn't.
Good.
Let's help the baby turn to slip its shoulder out.
Great.
The rest of the body will follow.
All right, let's just help pull the baby out of that birth canal. Here we go, baby. Yank that out. Great.
The baby is born. Now, let's remove excess fluid from the baby's airways using the suction bulb.
Can you tell that baby to shut up? Okay, I'm having a stressful day here. I'm seeing things that I did not think I was gonna see, and I don't feel great about it. I don't even know. What's going through my head right now, honestly, guys, is how am I gonna edit this video so that it's just not one big old blur, so you can't see anything. Okay, let's just stick this up the baby's nose. Suck out that stuff. I've seen that done before, actually. I've watched childbirth before, guys. We did it in like health class in grade 9 or something. Okay, and just clear that out as well. Good. Good job, baby.
We're almost there. Clamp and cut the baby's umbilical cord in order to detach it from the placenta.
I like how they, you know, they show me this screen here, but they made sure there was still a little bit of veg poking out up here in the top, just so that I'd have to actually do something about it when I edit the video. Great, well, let's just move that out of the way. Okay, and this one too. We're clamping it and then we're gonna cut it. Snippity snip.
The doctor, midwife, or nurse will assess the baby's breathing, heart rate, color, reflex response, and muscle tone and assign a score ranging from 0 to 2. While some staff members are tending to the baby, others are with the mother because her work isn't done. During the final stage of birth, the placenta is delivered.
Great.
Removing the placenta requires just a bit more pushing by her new mother.
Well, that poor woman, she just squeezed a baby out of her, and now she's got to push a placenta out as well, and it's going to take more pushing? Oh, no, she said just a little more, as in, like, just a small addition. I thought she meant, like, this is going to require more pushing than when you push the baby out. Okay, so we just got to give that a tug and pull it out. Out it goes. Look at that big old bag of
to the cervix or
flesh.
vagina during birth, we would suture them. But in this case, our mother is fine. Sometimes a doctor will perform an episiotomy, which is a common practice in which the mother's vaginal wall is surgically cut during the second stage of labor to provide a large baby to pass through the birth canal more easily to avoid excess tearing. After birth, the cuts are sutured. A pediatrician will examine the new baby in the hospital to make sure he is doing well, and in a couple of weeks will want to see the baby in his or her office.
Baby, I need to see you in my office immediately. Oh no! What have I done?
Thanks for stopping by Parent Point and helping bring a new life into the world. Why not check out the other exciting parenting information and procedures that we have to offer here on ParentPoint.com.
No. Please just go. Just go. That's enough for me. I'm done. What? Is that it then? You just move your head a little bit? She's like, okay. How long do you have to stand here and like blink and just wait? If I stay here, will you just continue to do this? This is great. Usually when the surgeries are done, they're like, hey, check out this one now. Like an outro on a video. Hey, check out this video now when you're done. When you're done looking at vaginas, pushing babies out. Okay, so basically, guys, we just did a natural childbirth, but sometimes you don't get a natural childbirth. Sometimes you got to cut yourself open and just yank the baby out that way. Okay, so we're gonna do a C-section next. I'm gonna skip the epidural one. There's another one where you give the mother a little bit of drugs first, but who cares? It's pretty much the same thing, I would imagine. So we're gonna move on to a C-section. Okay, this was really something, man. Wow.
Welcome to Surgery Squad's virtual cesarean section.
Dr. Jeff.
I'm Dr. Jeff, and I'll be guiding you through this surgery today.
Okay.
A cesarean section, commonly referred to as a C-section, is an inpatient procedure where a surgeon makes incisions in a woman's abdomen and uterus to deliver a baby. This procedure is often performed when a physician determines it to be a safer delivery option for the mother, baby, or both. As with any surgery, the use of alcohol and tobacco increases the time it takes to recover, and if the mother has used alcohol or tobacco products during her pregnancy, it can also cause serious birth defects.
Yeah, don't do that, guys.
Our patient today is in her early 30s and is relatively healthy.
Is she back again with another baby?
Of high blood pressure.
Man.
Luckily for us, we get the opportunity to deliver her first baby.
First baby?
Now that we've covered the basics, let's scrub in.
But she just...
We'll begin the procedure by inserting an IV into our patient's hand so that we can provide her with any medication and fluids she may need.
All right, Doc, let's do it.
I've already tied a tourniquet
I get it,
on
Doc.
the
Let's
patient's
just
upper arm.
Can
you find a
Doc,
suitable vein in the patient's hand?
Shut up. Thank you. There.
Looks good to me. Next, we need to sterilize the insertion area using an alcohol wipe.
I got a question, guys. Does Dr. Jeff sound a little bit different today to you, or is that just my memory not serving me correctly? Because I'm pretty sure that's not the normal Dr. Jeff. I don't know if he's just got a different mic setup today when he's doing voiceovers, but I'm a little bit concerned, okay? What did they do with Jeff? Who is the new Jeff? Okay, click and drag the alcohol wipe over the vein to sterilize it just like that. There, that's done. Okay, continue.
Now that the area is disinfected, it's time to insert the needle and advance the angiocatheter into the vein. Take a stab at it.
Take a stab at it, Dr. Jeff? Take a stab at it? Bitch, this isn't no walk in the park here. We're doing surgery. I'm gonna do a light poke, okay? Jeez.
The small burst of blood that you just saw in the angiocatheter hub is known as a flashback. This lets us know that the angiocatheter is correctly positioned in the vein. Now I'll release the tourniquet. While applying gentle pressure over the vein to collapse it, you can remove the needle. This will reduce the amount of blood that may pour out of the angiocatheter while the needle is removed. Once you remove the needle, I'll properly dispose of it in a sharps container.
Wait, what? The needle? I thought we were doing the... Oh.
I'll lock the IV tubing to the angiocatheter by rotating the locking mechanism. And finally, we need to secure the IV with tape and test the IV line. Excellent job.
Thank you.
Was it easier than you thought it would be?
No, it was about the same.
In order to reduce the amount of discomfort our patient may have, we'll be giving her a spinal anesthesia. This differs from an epidural in that we'll be injecting the anesthetic directly into the spinal fluid that surrounds the spinal cord, and there's no catheter involved. First, clean the area using iodine-based antiseptic solution.
Okay, well, so we're just gonna be giving her a little bit of drugs here today, guys. No big deal. Okay, everybody likes a little bit of drugs down there, and that looks good. I like it.
Next, we'll inject a local anesthetic to decrease the pain the patient will feel when we inject the spinal anesthetic.
You got it, Big J. You mind if I call you Big J? I just thought it was a good name for Dr. Jeff. Big J, yeah, let's do it. Let's poke in some needles, bro. Yeah. Woo. Good stuff. Okay, what are these? Around the patient's spine. So far, so good.
Now we need to inject the spinal anesthetic directly into the patient's spine.
That sounds dangerous. Like, I'm kind of worried about that. I wouldn't want that kind of thing happening to me. Look at that. Just poke it in there. Done.
Now just place a bandage over the injection site and we'll move on.
Okay. There you go. It's done.
Great.
Got it.
Before we can make any incisions, we need to clean the patient's abdomen with an antimicrobial iodine solution.
All right. I was just going to use soap and water, but whatever you say, man.
Now use the scalpel to
I didn't even do it. I just skipped that one and it worked.
As the incisions are made, you'll need to separate the layers of tissue, fat, and muscle. Are you ready?
No, I am absolutely not ready to separate no layers of anything, but okay. There you go. That's the one. Skin.
It's getting a little messy in there.
Yeah.
Use the suction to clear out some of the excess blood and fluid.
Slurp it up, bro. I like to imagine there's a guy on the other side just going... That's kind of disgusting.
Insert the retractor to push down the patient's bladder.
Okay. Push that down. How is that magically going up on its own?
Make an incision into the patient's uterus so that we can begin the delivery.
I see a baby.
Be careful, though. We don't want to accidentally injure the baby.
Yeah, that'd be less than ideal for sure. Okay, there's a baby head right there, so just careful what you do there. I guess I'm talking to myself here. Careful, Matt. Don't want to hurt the baby.
We're almost there. Sometimes a surgeon will need to use forceps to help the baby out, but not in this case. The next step is to apply pressure around the baby's head to assist us in removing the baby from the uterus.
Just imagine that. Forceps to get a baby out. Man. Like, I gotta set up barbecue tongs. Can we use those instead? Is that good? What am I doing here? I'm just twisting that baby out? Hey, look at that. It's a head.
Before we completely remove the baby from the uterus, use the suction bulb to suction fluids from the baby's nose and mouth.
It's so weird, man. Look at that. Just jam it in there. You're gonna suck the fluid out of the kid's brain like that. Careful, man.
Now, let's have a baby.
Well, great job, Dr. Jeff.
The baby from the uterus.
Maybe we should have just kept that baby all stuffed up so he wouldn't be crying. But he stopped. That's good. He stopped. Okay, let's just give it a yank. Come on, baby. Out you go. Yay, we did it.
Excellent. But we're not done yet. Clamp and cut the baby's umbilical cord in order to detach it from the placenta.
Tell you what, I'll clamp the umbilical cord while you clamp the kid's mouth, okay? That'll make it easier on both of us. No? What am I doing here? Okay, yeah, cool, done.
It's a girl. Congratulations. Our team of nurses will take the baby to be cleaned, weighed, and examined before allowing her mother to hold her. In the meantime, we need to remove the placenta.
Okay, let's remove that placenta. Here we go. Just give that a yank as well. That's gonna pop right out. Ugh! That's disgusting. Did you know some people eat their placenta afterwards?
We'll need to close the incision sites. I think we'll go with absorbable sutures instead of surgical staples to reduce discomfort and so that our patient doesn't have to worry about having them removed. You can take it from here.
Okay. Yeah, some people just make a meal out of it. You're gonna have a baby, you might as well eat while you're there, you know? I mean, you're staying at the hospital, they gotta give you a meal. No, something about all the nutrients inside the placenta, and they eat it, and like that's not gonna happen with me. I ain't gonna be eating no placenta when I get a baby. I was gonna say when I have a baby, but I don't plan on having my own baby. I'm planning on getting a woman to do that for me, at the very least. Okay, well, just stitch all that up. What am I doing? Where's that? There we go. Did I get it? Yeah, I got it. Okay, Dr. Jeff, we make a great team, man. I really miss you back in that natural childbirth, man. It would have been a lot better if you were there, okay? Cause I was with a stranger, and I was scared, and I needed an adult, and you weren't there for me, man. But there we go. Look at that. It looks like a nice little smile on the abdomen. Just stitch all that up, and I think we got our baby all taken care of. Yeah, I don't hear any crying, so I guess the baby's not in the room anymore. That's a plus. A+ job, guys. A+ job. Yay, it's done.
You did an amazing job. Now, the recovery process begins.
Dr. Jeff, you are so sweet.
And that is a C-section. I think you should test your surgical skills in another surgery here on SurgerySquad.com.
That's what I like to see, Dr. Jeff. That's what I like to see right there. Did you guys notice that Dr. Jeff said I did an amazing job? I don't think Dr. Whoever the hell the other person was said that. I didn't know she was a doctor. She might have been a nurse, maybe. I don't know. I wasn't really paying attention. The point is, she just said I did a great job, and Dr. Jeff said I did an amazing job. So who's a better doctor here? Dr. Jeff. But we already knew that, didn't we? Well, there you go, guys. That was both a natural childbirth and a childbirth via C-section. Thank you so much for watching this video. If you enjoyed it, don't forget to leave a like, and I will see you next time. Goodbye.